Good morning. Welcome to the Department of Family and Support Services Women Focused Community Reentry Support Center RFP webinar. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we'll respond to questions at the midpoint and end of the presentation. Please use the questions box to notify us of any technical issues. This webinar is being recorded, and anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by the Department of Family and Support Services. The purpose of this webinar is to provide information for this solicitation. A copy of the recording will be posted on the DFSS YouTube channel with the link to the recording on the DFSS webpage at www.cityofchicago.gov under the alerts and or funding opportunity tabs. This will take up to 5 business days. DFSS retains the right to share a list of registrants to this webinar along with their contact and organizational information at our discretion. At this time, I'm going to give the floor to the Workforce Services team to introduce themselves.
Good morning, everyone. My name is Mark L. Sanders II. I am the Deputy Commissioner of Workforce Services for DFSS. We are excited to be here this morning to talk about this great opportunity we have to serve women returning from incarceration to the city of Chicago. I'll pass it over to Cindy.
Good morning, everyone. My name is Cindy Rivera. I am a project manager here at Workforce Division at DFSS. And looking forward to providing information regarding this wonderful opportunity that we have here for especially focusing on women.
Thanks, team. At this time, we're gonna go through the purpose of the RFP, the background, overview of program and service delivery, eligibility, evaluation and selection process, selection criteria, timeline, technical assistance for applicants in e-procurement, and then one last round for questions. And with that being said, I will pass it over to Workforce to discuss DFSS mission and priorities.
Again, we just want to do a little overview on the DFSS mission and priorities. So one of the things that the DFSS does connect our residents to resources that support stability, well-being, and opportunity. Our services are empowering, so we do deliver high-quality, client-focused services that help people thrive. We have collaboration among community. We work with partners to drive policies and programs that create lasting change. We provide resource awareness. So we inform the public about support available through DFSS and its partners. And we also are, we're accountable, right? We use our resources responsibly to ensure strong impact and outcomes. So I want to talk a little bit about the DFSS Workforce Division. And again, I'm not going to read it verbatim. We are going to provide these slides after the webinar. So I just want to just provide some context. So we here at DFSS Workforce, are committed to mobilizing innovative workforce solutions that are tailored to our distinct target population, which are usually faced by our most vulnerable Chicago residents. We emphasize human-centered, trauma-informed approaches in safe, supportive environments, and we deliver career navigation, job training, and transitional work opportunities to adults 18 and over in high-promise Chicago neighborhoods. So the purpose of this RFP, so we want to launch a citywide reentry center for women or focus on women. It should provide safe and supportive trauma-informed services, also being gender responsive and holistic care. And the core values that we want to include are they have to be equitable and within access, person-centered support, and we also want to have a system collaboration. The goals. So one of the main goals for this RFP is to support a minimum of 100 women that are returning from CCJ, which is the the Cook County Jail, or IDOC, which is the Illinois Department of Corrections, returning to Chicago, excuse me, with reentry navigation services. I'm sorry, excuse me. So one of the things we aim is to provide tailored, gender responsive, trauma-informed services to help women stabilize, heal, and rebuild post-incarceration, right? We also want the selected agency to operate a call center and deliver individualized reentry navigation services. Again, serving those that are returning from CCJ and IDOC, or those who are under supervision, or those who are lacking reentry support services in their neighborhoods. The focus is to reduce recidivism. We want to improve their well-being, and we also want to promote long-term success with this program. Current state and priorities for improvement. As you can see on the left, we have current state on what's going on. Right now, it shows that there's 6,694 people that are returning to Chicago from IDOC in 2024. Over 60% of them remain unemployed after 1 year. A lot of them face housing insecurities, mental issues, and substance challenges. One of the highest reentry rates concentrated into 15, we say disinvested zip codes, which include West Garfield Park and Inglewood. Our regular community reentry service centers, which we have 5, handled over 11,000 phone calls, served 2,840 clients, and 46% of those sought employment. What we know with women is that only 5% are of prison population, but 11% are community reentry support services clients. We understand with women, they face a greater form of trauma. They have caregiving issues as well as health. So again, with the priorities that we have for this program, we want to ensure that they have a safe, trauma-informed space tailored just for women. We want to have this consistency, outcome-focused care at all our sites. We want to provide them access to training, to jobs, and internship. In regards to partnering, we're partnering with the Mayor's Office of Reentry, as well as our other community reentry support centers. And we want to focus on this person-centered model, right? We also want to make sure that we teach communication and recovery skills in order to provide lasting reintegration to the community. Again, an overview, because we want to make sure that we're very specific on what is it that we're looking for. Again, the goal is to support a minimum of 100 women returning from CCJ or IDOC. And again, we want to provide support, tailored services to build their stability. We want to support their well-being, and we want to empower them to thrive. The service overview, so we want to provide holistic, gender-responsive, trauma-informed reentry navigation to women and non-gender individuals. So we want to make sure that we're really specific about that. Our target population include anyone who has been system impacted or age 18 plus, who identify as a woman or a non-gender conforming individual. Again, individuals coming from CCJ and IDOC, or those who are under community supervision, which is probation or parole, or those who are already living in community, but again, lacking access to appropriate reentry resources. So we provided a subset of the key performance metrics. I'm just gonna pick a couple, and you could read this, and this is again also in the RFP. We wanna have 60% of all the participants who receive reentry navigation services complete or on track to complete community corrections requirements. And another one is to ensure that 80% of our participants who receive navigation services report advancement toward one of their goals. And then we have our priorities. So the respondents should be able to anticipate fielding a minimum of 500 calls annually to the call center. That is very important. And also something that's going to be tracked closely is we want to make sure that reentry navigation services are being provided to a minimum of 100 returning residents each year. And all of the 100, we want to make sure that at least 50% of those participants must have a probation or parole mandate. Funding. So the contract period for this program is from January 1st from 2026 through December 31st of 2028. Each award will be $375,000 per year. This is on reimbursement only. No advancements will be given for this program. And the funding for this program is made available from the City of Chicago Corporate Cannabis Regulation Tax Funds. Target population. Again, we want to make sure that it is understood that our target population is women identifying and non-gender conforming individuals, Chicago residents who are aged 18 and older, and then any returning residents that are justice involved, system impacted, or literally returning from those two correctional facilities. Program requirements. So we want to make sure that the respondent, they have to show capacity to operate this particular CRSC. So we need to make sure that you could do the following, but this is just a list and it might not be limited to, there could be more, but in general, we want to make sure that the respondent maintain a physical site that's open Monday through Friday for in-person services. We want to make sure that the respondent could provide comprehensive connections to services, especially those for our justice involved individuals. We would like for respondents to assign a reentry navigator to ensure that the delivery of these individualized goal-oriented support is provided. We want to make sure that the respondent offer education, that they offer job training and employment assistance. We also want to make sure that they provide mentoring and legal support, including expungement and record sealing. And the last is make sure that they support individuals under probation, parole, or court mandates with community-based services. Program delivery. So with this program, we set it up to have 3 distinct tiers, which means that the selected respondent would have to provide a comprehensive range of support within these 3 tiers. The first one, we talk about the call center support. So we want to make sure that these calls are immediate, that they help via the centralized phone line, and you're going to be assisting with info, referrals, and basic assistance. Tier 2 is walk-in support. So at this time, we want to make sure that there are in-person services for drop-ins. It's providing those assessments, providing those resource navigation, and any quick connections. For 3, that's when intensive case management comes in. And at this point, it's going to be ongoing individualized support for our clients, especially those with complex needs, including those that are under supervision as well. So we're going to do an overview of tiers for tier 1, which is our call center services. As you can see, it's going to be more like a centralized trauma-informed hubs for real-time reentry support core functions. So number 1, you need to make sure that there's going to be a dedicated call line that's open Monday through Friday from 8:30 to 5. And the requirement is responding to these emails between 24 to 48 hours. There has to be a minimum of 500 calls per year, staffed by trained trauma-informed personnel. There needs to be immediate needs screening and referral. So helping with housing, jobs, mental health, whatever it may be. Warm handoffs to navigators. There has to be a seamless connection to reentry centers and any follow-up support. Multi-modal access. So you need to serve your clients via the phone, email, or walk-in support. Trained staff. We really want to ensure that there's trained staff with the emphasis on trauma-informed care and active listening. Data tracking. We at DFSS are really into data, but we want to make sure that you're logging and documenting everything. So we want to make sure that you're logging any and all inquiries. Tracking those outcomes are very important, and we're going to use data to improve any type of services. Also, we want to make sure that the respondent has the strong partner coordination. So aligning with IDOC or CCDOC with any other community-based organizations and workforce systems. Outreach strategy. Again, we want to make sure that there's a marketing plan in place to boost visibility among the returning residents. Welcome packets. We want to make sure that our respondents provide resource guides to support our returning residents on their reentry journey. Tier 2, which is our initial assessment and resource connection. Number 1, we talk about comprehensive intake assessment to identify needs. So we want to make sure that the participants are assessed with their needs through an in-person evaluation. Then we talk about immediate resource linkages, right? Like employment and education, IDs, vital documents, mentoring and legal and housing and stability. Want to make sure that there's direct resources or referrals. So there has to be the seamless connection to appropriate partner agencies. And again, we want to focus on that client-centered approach. So again, making sure that any support is tailored based on the individual needs. For tier 3, we talk about intensive and individual navigation. So this is the part when it's a one-on-one support. So we want to make sure that our respondent provide this personalized guidance that's tailored to each of the women's reentry journey. We talk about hands-on assistance by a navigator, which we feel is very, very important for success, right? So we talk about scheduling and attending appointments or coordinating transportation. We also want to make sure that the navigator provides in-person support at the service site. We also want to have that ongoing follow-up, right? So we want to track those progress. We want to talk about successes. We want to adjust plans when need be, and we want to maintain that engagement moving forward all throughout the process. And then compliance support. So we want to make sure we help meet parole and probation conditions, and we want to reduce that recidivism rate. Now we're going to go into program components, or like the key areas of the service. Again, let's talk about the call center operations. Want to make sure that there is a trauma-informed phone line, which is offering real-time support and referrals. We have the reentry navigation, which is a one-on-one guidance to help participants navigate reentry and then meet those supervision requirements that they have. We also have the supportive services and referrals. Again, having that direct connection to housing, employment, healthcare, legal aid, and any other services that the specific individual needs. We want to have that service coordination, right? So have that partnership with correctional agencies, with other city agencies, or any other community groups to ensure that streamlined support is there. And also, we want to keep that participant engaged and also have that feedback. So we want to have the respondent use client feedback to improve services as we go along this process and keep them responsive to their actual needs. Here we have additional program components or key elements. System-wide referrals. So we're looking at this center to refer any male participants to any appropriate CRCSs to the other 5, since again, this is more women focused. And we're also accepting referrals from 211. And of course, the sister agencies are other community resource reentry support services. We want to talk about the reentry navigation. Again, it's just providing that individualized support to help participants like overcome their reentry barriers and meet any supervision conditions that they have. Those supportive services and referral, again, is connecting participants with any essential resources that they may need or that you may have. Service coordination, again, working closely with those agencies and that participant feedback. Again, just having that input from the participants to enhance and tailor their services for better outcomes. So for this program, we have specific key metrics that we will be following and we'll be tracking just to ensure that our clients are going towards that outcome goals and again, assessing success. So you can see, if you go through it, these are also in the RFP, just picking one so we could just highlight it. 80% of our participants who receive reentry navigation are successfully referred to the requested need. So whatever it is, whether it be mental health, counseling, public offense, whatever it is, we want to make sure that that's being tracked, and DFSS will be tracking that outcome as all of these outcomes as well. And one of the things we do want to say is that we are planning to track additional key output metrics, but we also want to have the respondent recommend any type of metrics that you feel we should follow, that we should incorporate, that would actually provide us more insight into the program itself. Also talking about key requirements under case management and data reporting. So the respondent will be providing, we would have ongoing check-ins with DFSS and also with the Mayor's Office of Reentry. In regards to data collection, we'll be tracking and reporting demographics, service delivered, and performance data as well. There will be monthly reporting, so you're going to be submitting specified reports every month, but that could change because it could be any additional reporting as well. ECM, you're going to be entering all participant data into the enterprise case management system, which we call ECM. And there's also flexibility for additional reporting. So we just want to put it out there, be prepared to provide any additional reports upon request. In regards to case manager, we want to make sure that you are tracking and documenting anything and everything that you're doing with your clients. So we want to make sure that that's being tracked somewhere. It could be either in ECM or in the monthly reporting. But these are some of the things that we're going to be looking for. So we want to make sure that you track when you do those intake and assessments. You know, document that in ECM with any supporting documents. We also make sure that you're in the developing any ISP or any individual service plans based on the client's needs. We want to make sure that you are logging all the services, all the referrals, and all the outcomes as it relates to your clients. We want to make sure that you're keeping these case notes in detail, right? After every interaction. We want to make sure that you're tracking parole and probation compliance. We want to make sure that you're recording any key milestones in regards to like employment, housing, education, or anything else that you would want to share. We want to make sure that you're scheduling and documenting these follow-ups and the outcomes. And at the end, you know, very important is completing those case closures. And we want to make sure like what's the final outcome in regards to your clients. Reporting. So this is one of our reporting templates, which we'll probably have monthly submissions from the providers. Again, this is just an example and it could be subject to change at any time. And to the left is just our cover sheet and what is it that we're gathering from our regular community reentry service centers. Again, this may change. It might not look exactly the same for the women focus, but just to give an idea on what it could look like. To the left is the reporting categories, and to the right is basically just breaking it down and providing the data on a monthly basis. And here again, it was just a long spreadsheet and I just cut it up, just talking about, again, all the metrics are listed here. And any other additional metrics that we feel are important in order to reflect in this program will be added in this report. And again, it will be the responsibility of the respondent to submit this on a timely basis. So eligibility, evaluation, and selection process. So let's talk about who is eligible to respond to this RFP. So this is open to all nonprofits, faith-based groups, and you could apply single or you could apply along with subcontractors. The evaluation process, so each proposal will be judged on strength and responses. As you can see, the selection criteria is to the right, and the points are also listed there, so you could see exactly how points are going to be added to each criteria. So the selection process. So proposals will be evaluated on strength and responsiveness to the criteria. So we want to make sure that respondents detail their answers to the point that we want to see like the actual program reflected on paper, right? So if you, we just want to make sure that you answer each question thoughtfully and include detailed responses. Again, we're going to evaluate on those strength and responsiveness to the criteria, to whatever specific criteria is listed. DFSS may consult other city departments during the review. Any top scorers may be invited to do oral presentations, and we will provide advance notice for that. Incomplete or unresponsive proposals will be rejected. Funding may be denied based on past performance or current area needs. And we just want to make sure that all the services being provided must be citywide and culturally and linguistically appropriate. I can't pronounce that right. Additional content for that. So again, you must show citywide capacity. That is very important in how to serve women reentering from incarceration. DFSS may assess leadership, coverage, and service and the ability if there are specific subpopulations. DFSS reserves the right to request clarification. We might conduct site visits or interview, or we might require oral presentations. Again, just to ensure incomplete or unresponsive proposals may be rejected. Final selection pending contract execution. So again, selections are not final until contract is fully executed, and the Commissioner of DFSS may adjust awards based on past performance or area need. So now we're going to get into the selection criteria. So these are the points that are going to be used to assess your proposal. So the first one will be community involvement. Looking at this, so we're going to be looking at, does the respondent demonstrate deep understanding of the unique needs of the women returning from incarceration? Have you proven experience and infrastructure to effectively serve this population? Is your leadership reflective of and engaged within the community? Do you have a strong track record partnering with IDOC or CCOC for pre-release engagement? For the second one, which is organizational capacity, keeping this in mind, do you have qualified staff for program delivery and management? Ensure that you have a strong fiscal monitoring and control systems. Want to make sure that you have an effective data collection and security process. And we want to also make sure that you have the capacity to deliver digital literacy services, for instance, a computer lab. For the strength of proposed program, want to make sure that your responses are clearly defined. They're evidence-based services which are tailored to the needs of returning women. Want to make sure that you have a strong approach to participant recruitment and retention. We want to make sure that you have leverages, right, with partnerships to deliver these holistics and client-centered support. We want to make sure that you have systems in place to manage and scale reentry navigation for at least 100 women annually. Performance management and outcomes. Again, the respondent needs to ensure that they have a strong track record of delivering outcomes for the target population. Want to make sure that you use data to evaluate and improve those services. And want to make sure that you have systems in place to track participant and performance data. Reasonable cost, budget justification, and leverage of funds. We want to make sure that the respondent demonstrates fiscal capacity to operate and be reimbursed. Want to make sure you're leveraging additional funds and any type of in-kind support. And that the budget that is being submitted aligns with the scope, resources, and is cost reasonable. Selection criteria. So we have attachments. So you want to make sure that you include any and all reports or studies or that show program impact. Want to make sure that you submit at least one letter of support or recommendation to just attesting to your organization's capacity to carry out this work and include it in your RFP. You want to make sure that you attach the resumes of all the key staff who will be overseeing this program. Include your organizational chart and your budget. Again, please ensure that all program requirements are addressed in the attachments. So here is our selection and transition timeline. So we have the pre-proposal webinar, which is today. The due date to submit pre-proposal questions, you have until May 28th. Applications are due on June 20th, 2025. So we want to make sure that everyone understands on June 20, 2025 at noon, it is cut off. There's no extension. That is it. And this program should be up and running starting January 1st of 2026. So let's talk about budgets or cost proposals. So again, there's going to be a total of $375,000 that will be awarded annually to the respondent. The key deliverables for this will be managing this cost center with 500 calls per year and serving 100 returning residents per year. Women, just want to make that clear. There should be a max of 15% for program and administrative costs on your budget. Submit the 12-month budget, again, with the contract for 1 year. We're looking for a 10% match is recommended, okay? This program is reimbursement basis only. There's going to be no advance provided. We want to make sure that you're following the budget instructions and use the cost definitions provided. Know that request appropriate funding, right? Because we cannot adjust the request later. We cannot provide anything more. So be very thoughtful when you provide your budget and how much is it that you would actually need to effectively run this program. Ask for what you need because people tend to sometimes under budget for supplies and other costs like that. So again, just being thoughtful when you supply that budget. And when you're doing your budget, we've been seeing a few of these common errors. Make sure you double check your fringe benefits. Make sure you accurately budget for supplies. Include client assistance. Ensure job titles match. Provide a brief descriptions in the budget. Make sure you're entering the budget information in the correct column. And we want to make sure that you clearly show your match contributions. again, we want to make sure the system does not allow us to accept any late applications. So June 20, 2025 at noon, that's when the system will close and we're not going to be accepting any more applications. So make sure that you complete them right before that time.
Thank you, Cindy. Before we go into application tips, we do have one question. It says, what if our organization CEO is a man, but our women's division / program is women led, and she's who would lead this project?
Yes, thank you, Jillian. I am also typing this response in the chat. However, I think we will welcome that application. However, you'll need to clearly explain that in your responses, and each individual application will be reviewed and scored based on the total responses. So that is just one aspect. That's just one criteria we are using. However, if an organization that is led by a man, or if your fiscal agent is led by a man, those factors, those considerations will be factored in to the overall proposal. So in those situations, you just need to make sure that your justifications and your responses are comprehensive, and they can show the overall impact that you'll have. But all that to say, that will not automatically disqualify you from leading this work.
Okay, thank you, Mark. Application tips. Our first tip, most important tip, is to start your application as early as possible and save it often while you're working on it. And if you have never done business with the City of Chicago, please register into iSupplier as soon as possible. Review RFP narratives and application questions closely. Remember that they align with the scope and the selection criteria. Use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuation and spaces. Each response is allotted 4,000 characters. Please do not use the back button on your browser while you're working on your application. And again, start as early as possible and save it often while you're working on it. To submit multiple applications for a single RFP, applicants will need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. You can submit your application and later amend it up until the due date of June 20th at 12 noon. You can avoid the rush and possible mishaps by submitting your application early. Please plan on your submission taking approximately 30 to 60 minutes. Please be advised, late applications cannot be accepted. At 12, you can no longer submit your application on June 20th. For technical issues, please make use of the e-procurement hotline for help at 312-744-4357. They also can be reached via email at customersupport@cityofchicago.org. As far as the hotline, it operates during business hours only, which is Monday through Friday, 9 a.m. to 5 p.m. Again, we can't stress it enough. Start your application as early as possible and save it often. Agency requirements. We require agencies to provide articles of incorporation or any amended articles of incorporation. We also require an IRS affirmation letter, and this is for not-for-profit agencies. The letter must be dated within 60 days of your submission. You can obtain this letter by calling the IRS directly at 829-5500. If you are a for-profit agency, submit your original letter from the IRS showing your FEIN number. We require a UEI number as well as a central contractor registration, which can be obtained from the entity overview page on the sam.gov website. And we also require a certificate of good standing letter with the state of Illinois. As of April of last year, we have a new labor peace agreement ordinance, which will apply to all DFSS and CDPH delegates that have 20 or more employees working for their organization. Contractors must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. Contractor must enter into an LPA within 90 days of receiving notice from a labor organization that it seeks to represent employees. You may ask, what is an LPA? A labor peace agreement is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation. In return, they will not strike or stop work in a way that will impact human services. For technical assistance on the DFSS webpage, there will be a link to the RFP of interest and training documents. Please see the alerts section on our website. For questions on registration and e-procurement technical assistance for delegate agencies, please reach out to customer support at cityofchicago.org, and they also can be contacted via phone at 312-744-4357. We also have training materials, which includes documents and videos on the cityofchicago.org website under online training materials. At this time, we're gonna delve into how to enter your responses and accepting amendments. Step 1, you're gonna create quote. You're gonna select create quote from the drop-down menu in the actions box and then click on go. This will take you to the application page where you can get started. If the RFP you are interested in has been amended, you will need to acknowledge and accept the amendment to start or submit a response. And to accept the amendment, click on View Amendment History. To begin the acceptance and acknowledgement process, follow these steps after clicking View Amendment History. First, you click on the document number. Next, click on the Infinity or eyeglass icon to review the amended changes to the RFP. Next, click on the Acknowledge Amendments button to acknowledge receipt and understanding of the changes and proceed. By acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. When you see this screen, you click on the I accept checkbox and then you click on acknowledge. Then click on yes to indicate that you confirm your acknowledgement of the amendment. Finally, click on the checkbox that you accept the terms and conditions and then click on accept to accept the terms and conditions. And that is the final step in acknowledging and accepting the amendment. Once you accept the amendment, we can delve into how to submit your application successfully. So once you've accepted the amendment, you enter all of your responses to the requirement questions. You've attached all of the required documents, and you are finally ready to submit. You can start by saving your draft one last time and then clicking continue. While you're working on your application, if you are missing information, you will be given an error message at the top of the page. It will be a red X that says error, can't miss it. Usually the error message directs to something left undone in the application. So in the last example, the error message indicated that the lines which are found under the lines tab had not been completed. In this example here, the error is about an unanswered question in the application. The quote value that they're referring to refers to your missing answer. So once you've resolved the error and your application is free from errors, you're ready to proceed and submit. And at this point, clicking continue should put your application into the review and submit phase. Once you see this screen, this is like a summary page. And this is also your last chance to review all of your data and to confirm that everything is accurate. Check your attachments one more time and scroll to the bottom of the screen to see and review all of your responses. And once everything checks out, at the bottom of the screen, you'll be asked to provide an electronic signature. Please be sure to fill in that signature before checking the box. After you check the box, you can move forward with submitting your application. Once you submit your application, you will see this submissions confirmation screen here, similar to what's on the page right now. The e-procurement system will also send a confirmation email within 24 hours of your submission. However, you can email me if you desire confirmation prior to then. At this time, we're gonna pause for any last questions. Again, our question due date for this RFP is Wednesday, May 28th. So if you don't have any questions right now, you still have time to send some. You can send program questions to the RFP lead, which is Cindy Rivera. She went through all of the requirements earlier in the presentation. She can be reached at 312-746-8857. 8858, sorry. And her email is cindy.rivera@cityofchicago.org. And for any non-programmatic questions, if you have questions regarding e-procurement or you're having any issues, you can reach out to the e-procurement hotline. Again, they're open Monday through Friday, 9 a.m. to 5 p.m. They can be reached at 312-744-4357. And they also can be reached via email at customersupport@cityofchicago.org. And you can also reach out to me. My name is Jillian Black. I'm the procurement proposal coordinator, and I can be reached at jillian.black@cityofchicago.org. Workforce team, do you have anything to add before we close out?
No, just want to say thank you all for attending. We appreciate your interest in this RFP. This is something new and exciting and innovative that we are launching in the city of Chicago. We are looking to you all to help lead this work. There will be a lot of iterations, a lot of questions, a lot of building up before we get to as close as we want to get to perfection. But we want to use this opportunity to lay the foundation of how we want to support women and non-gender conforming individuals throughout the city of Chicago. And so if there are any questions, as Jillian mentioned, please reach out to us. You can email Cindy those questions, and they will be posted in the amendment section of the RFP. And we look forward to reviewing your responses. Thank you, everyone.
Before we close out, I thought it was a question. It just says, thank you all. We are excited for this RFP for the women justice impacted. It's been long awaited.
Thank you, everyone.
Thank you and good luck on your responses to the RFP. Thank you for attending our RFP webinar and enjoy the rest of your day. Thank you.